Hi everybody, welcome to today's video. If you've clicked on this video, you probably have an endoscopy nurse interview coming up, and I'm going to give you lots of tips to help you prepare for interview questions. I'm the author of the book, How to Prepare for Interviews and Develop Your Career as a Nurse or Midwife, and I've spent my career supporting nurses through interviews. So if you find the tips in this video useful, don't forget to give it a thumbs up and subscribe to my channel for lots more free videos to support your career development. Before I go through some potential interview questions, it's important that you do your background research. You never know what questions are going to come up, and doing some research will help you answer a range of potential questions, such as what does the role entail? What are the most important responsibilities of an endoscopy nurse? You're inevitably going to be asked questions about the role that you're applying for in your interview. Why have you applied? So you need to fully understand what the role entails and what the endoscopy service provides, because it can be different across different employers, such as preparing patients, scrubbing and assisting with diagnostic endoscopic procedures, assessing and monitoring patients, reassuring patients before, during and after procedures, the importance of documentation and equipment management, risk assessing patients. So it's helpful to review videos where endoscopy nurses work and talk about their role, but also look at the job description. Go through the job description and highlight key words and terms. For example, the types of procedures that you're going to be involved with, because you might be asked about those procedures. And each job description will be individualized to that employer. It's important to also review the employer website, their mission statement, their vision, and how they align with your own values. Employer and service values, it's helpful to know about, and you can also go to ask for an informal visit to a department as well, and you can book that through the recruitment lead, or you could have an online or telephone call instead during an informal visit, and it gives you a chance to visit the department, ask them about the service, patient pathway, the team that you'd be working with, what are the current targets for delivery or areas for development and service improvement. And I have a free video on my YouTube channel about informal visits, how to book them, what to expect, and what questions to ask. So looking at the role, the job description, the employer service values that you'll find on websites, employer websites, and conducting an informal visit is going to give you lots of background research. When you go through the job description, review the key terms, procedures and standards, because you need to understand them and be aware of them. So for example, what procedures are carried out as part of this role? What is the difference between a colonoscopy, gastroscopy, sigmoidoscopy, bronchoscopy? They may carry out a range of procedures, so to be aware of these terms and what they mean is important. Also, review national websites, policies and procedures for before, during and after procedures. Revise consent procedures. You could look at the Mental Capacity Act, for example, because if does a patient have the capacity to consent? And you may be asked a scenario-based question in your interview about that. Infection control policy, escalation policy, safeguarding and safe storage and use of equipment, medication administration and complaints procedure. These are all important procedures, guidelines that you can look up and just revise prior to your interview. It's also helpful to revise an A to E assessment, just in case you're given a scenario of a deteriorating patient, for example, excessive bleeding post-procedure, or managing a patient who is suffering from anaphylaxis. Also, World Health Organization surgical safety checklist is good to revise, as an endoscopy nurses often use a modified or adapted version of that checklist, and thinking about how you prepare patients for endoscopy and educate them about potential complications. To help some of your interview preparation, I've got several free videos on my YouTube channel that also summarise key terms that might link to your job description or your role responsibilities. So do check them out. I've got subjects such as quality improvement, quality assurance, risk management, clinical audit in healthcare, the difference between research, quality improvement, service evaluation and audit, clinical incident reporting, and lots more on there, but it's very much dependent on the role that you're going for. But if some of these terms you want to brush up on, these are really short, simple videos giving you a simple overview. Some national websites and resources that you might also find helpful: NICE guidelines, for example, gastro, esophageal reflux disease and dyspepsia in adults, can't speak today, investigation and management, that was last updated in 2018, and it goes through the procedures with endoscopy, for example. There are also websites such as the IBD UK and British Society of Gastroenterology, which is a society for any gastroenterology professionals. The British Society of Gastroenterology includes a nurses association with a committee dedicated to supporting gastro nurses. Membership provides access to exclusive events and educational resources as well. We've also got the Royal College of Nursing. They have a gastrointestinal nursing forum, and there's the European Society of Gastroenterology and Endoscopy Nurses and Associates. You can look up some of their papers, their websites, and just get a feel for that speciality. There are publications like the leading ones such as Gastroenterology Nursing, or the more multi-professional international journal called GUT, and that's world-renowned medical journal from the British Society of Gastroenterology. And you might be asked how you keep yourself up to date in an interview, and you could mention a recent article perhaps that interested you from one of these journals. In interviews, you're often asked about teamwork or collaborative working, because often endoscopy units and services have quite a small, tight team of multi-professionals. So it's important to know about the organisational structures that might include endoscopy team leaders, managers, up to executive board members in a hospital trust, for example. And sometimes you will see organisational structures in a diagram on a job description or on the employer website. There are key relationships between these people that work in endoscopy services, and you need to know what each role, what they do, what people do. And there may also be other organisations and relationships between organisations across different sites. So you might have several hospitals in surrounding areas carrying out endoscopies to support reduction of current waiting lists. So it's helpful information just to do a bit of research on the team and the service. Team structures often use a range of roles to support departments, from support workers right up to accredited nurse endoscopists. So they're specialist trained in colonoscopy or gastroscopy, and they have to complete specialist training, but they're able to perform routine diagnostic procedures. If you're unsure about a nursing associate role, they sometimes have them in departments. You might want to check out my video on the difference between a support worker, nursing associate and registered nurse. As I mentioned earlier, I've got free videos on my YouTube channel. And it's helpful to ask about the teams and the service when you book an informal visit, as I mentioned earlier, and you can ask about team structures. Prior to interview, it's helpful to reflect on some key examples that show off your current transferable skills. And you might be asked for specific examples from your current or past roles, especially in a value-based interview. So think about what examples you would give if you were asked to give an example of compassionate care or quality care or evidence-based, where you've integrated evidence-based practice. You might be asked about a positive example of collaborative team working or teamwork in an area, your person-centered approach, overcoming a challenge or learning from feedback, or if it's more of a leadership role, perhaps leading a project where you've impacted staff or patients and made a difference. And often one or two examples might cover all of those areas. If you have a good example, it might show quality care, team working, person-centered approach, for example. And this is a key tip for value-based interviews as well. I've just given a few interview type questions that link to practical examples. So you might be asked, what does compassionate care mean to you? Can you give me an example where you've provided compassionate care or quality care? Or they might say an example where you've provided evidence-based practice that made a difference to a patient. Can you give me an example where you supported others, either staff or patients or carers? Tell me about a time when you collaborated positively in a team and how this impacted staff and patients. Talk me through a challenge that you dealt with in your role as a nurse and how you overcame this challenge. Talk me through some previous feedback that you've received at work and how it improved your future practice. And a key tip when you're asked to give an example is to be focused. Don't just describe what you did and your actions, but also the impact of your actions and what that impact had on others or on the situation. And so it's quite helpful to plan those sort of answers before your interview and have some scenario examples, practical examples ready to share with interviewers if you're asked for examples. I've had some free videos on my YouTube channel to help you structure answers if you have a value-based interview or you need help with structuring answers. You can use the STAR interview method, for example. STAR interview structure or method is not helpful for every type of question, and my video on the STAR interview method, when to use and not to use, is helpful because it differentiates between questions where it wouldn't work, that STAR method wouldn't work, and where it works quite well in an interview. Also, if you're very nervous, some helpful tips in my video, Overcoming Nerves in an Interview. So you've done your preparation, and if we think about some initial interview questions that will always come up, generic type interview questions. So why have you applied for this endoscopy role? Within this type of question, the interviewers are testing that you know exactly what the role entails and that it aligns with your experience, knowledge and skills, that you're the right person for the job. So all the background preparation I mentioned earlier will help, where you're highlighting key aspects of the role and you can talk through how your current skills, knowledge and experience align to the role. But make sure that you're succinct and you're highlighting key areas. You need to show a passion for the specialism. What do you find interesting about this endoscopy role? How you think this role is going to support your individual needs and your career development, for example. Another typical type of generic type question would be, why have you applied to this organisation or service? Or what do you know about us as an employer or service? So again, doing the background reading I mentioned earlier, so you fully understand that, is going to help you answer this question. You might even be asked just a very broad question, tell me a bit about yourself, and you will structure that similar to why do you want the role, and start with summarising your experiences, your courses, highlight any key achievements and awards as well. And interviewers may also ask you some initial questions about your core values and your skills that you have that link to the role. What transferable skills have you developed in your current or previous role that align to this role? So if you're a student nurse, you can draw on past placement experiences and the skills you've developed. A helpful exercise that I mentioned earlier is to draw out your core skills from the job description. It's a great way to structure an answer. If evidence-based practice, patient safety, compassionate care, and leadership, for example, are highlighted in the job description, then think about your transferable skills in those areas. Or it might be education, health promotion might be in that job description. And these generic type interview questions should always be prepared for and rehearsed prior to interview so that you're really getting across your key points. And if you're very nervous, that it's helpful to do practice and rehearse those answers before interview and maybe have some bullet points under each of those questions. A few more generic questions that might come up. Typical question in interviews is, what are your strengths and what are your weaknesses? And they're going to be personal to you. I mean, it's helpful if your strengths align with the job description. So you're saying you're well organized, you promote high standards. And if you discuss a weakness, for example, you have high standards, you also need to, but you need to delegate more in your current role. So your weakness might be that you tend to try and do everything and not delegate as much. You could state how you're working on that weakness, that you're working on your delegation skills and you're learning to support and educate others so that they can be delegated different tasks where feasible. Or you could be role modeling or taking advice in clinical supervision sessions. But it's really important if you give a weakness as to how you're working on that weakness. Or how you address that weakness. Another typical question that comes up at interview often links to how you manage stress, and the interviewer wants to be sure that you've got the capacity to do the role without becoming too stressed and overwhelmed. For example, what areas will you need the most support with if you're offered the role? How do you manage stress at work? How do you maintain work-life balance in your current role? And these questions you can prepare for before your interview. Think about how you know when you're starting to feel stressed. What strategies do you use to decrease stress at work? Working as a team, seeking support from others, for example, and having pursuits out of work as well. How will you plan to keep yourself up to date with current evidence if you're offered this role? As I mentioned earlier, it's important to read around the speciality, what are the latest developments in the specialism, and I suggested some forums or specialist publications in the area to help you link to gastroenterology and endoscopy. Another question might be, where do you see yourself in 5 years' time? What are your future aspirations? So all of these questions are going to be very individualized to you, and it's helpful to really think about your future development plans in the future and how you're going to answer that type of question. In your interview, you might have questions linked to communication and team working, such as what's the difference between a support worker and a nursing associate, or what aspects of care would you delegate to a support worker or nursing associate, or other registered nurses in the endoscopy unit if it's a more senior role. And I have a helpful free video giving a simple overview of the differences between support worker, nursing associate and registered nurse if you're not quite sure about the differences between those roles. A few other example questions linked to patient communication and teamwork that might come up. How would you manage nurse-patient communication if the patient you were admitting did not speak English? So we usually have qualified interpreters and a process for identifying an interpreter that must be used for all healthcare interactions to ensure accurate communication, diagnosis and treatment, and to prevent delays and health inequalities as well. So, or the person might have a hearing impairment or be visually impaired. So think about practical, technical, emotional support you would offer patients in these cases. Another typical type of question might be, how would you support a patient during their endoscopy who is extremely anxious? And it could be before, it could be during, it could be after. So think about the type of approach you would use and the strategies you would use to reassure a patient and help decrease their anxieties. You should be empathetic, person-centered, and state how you would be like that, how you are going to get across that you're being empathetic. Or you might have to deal with a patient complaint. And how would you support a patient who wanted to complain about the care they'd received in the department? So it's very helpful to review local complaints policy and national guidance on patient complaints. And how would you deal with that situation at that time? Taking them somewhere quiet, listening, using active listening skills, for example. And this information is very easy to get hold of. So think about how you would answer this question. Sometimes in interviews, you're asked questions on how to deal with conflict and incivility in the team or with the staff member. How would you deal with that, especially if the role is more senior? And I have a free video on my YouTube channel that goes through the impact of incivility, looking at the research and how it impacts on staff and patients' experience, and how it can also impact on adverse events. And in a small team, an endoscopy service, everybody needs to get on, and you have to deal with conflict and incivility as soon as possible, because it could be dangerous in a unit such as an endoscopy unit. So you may be asked questions around this area, and my video is helpful. It gives you strategies of what you would do if somebody was incivil to you, or you witnessed incivility in practice. In the job description, you may have key areas such as meeting quality standards and the term safe practice, risk assessment. So sometimes questions will link to quality standards, such as how do you evaluate your care and performance at work? And this question's about gaining feedback from patients and from other members of staff, and how you would do this through peer or service user feedback, audits or service evaluations. You might also be asked about audits, and audits might be part of your role in your job description. So you might have a question such as, talk me through how you've contributed to the audit cycle or auditing in your current role. Now, you might not have carried out an audit as might be a student nurse or a very early career nurse, but you should know about the audit cycle, and everybody is trying to meet those standards, for example, preventing infection control. So you're looking at that service, but also you are gaining feedback from your patients and you're observing what's going on. So even if you're a junior member of staff, you're going to be involved in that audit cycle in some way. How have you learnt from past audits in your current role? And that's probably if you're going for a more senior role, you'll be asked about the audit cycle and the learning from audits. If you're offered the role, how would you contribute to service evaluation? So you need to know how services are evaluated locally and nationally. What is a service evaluation? What standards and policies must endoscopy nurses adhere to safeguard patients? So for junior roles, you should know about the key standards and policies that link to the role. So I gave some pointers early on my slides, such as infection control, consent procedures, etc. And how would you assure standards are maintained in our endoscopy unit? So have a look at quality assurance, clinical governance and standards, and all the preparation prompts that I gave you earlier in this talk. If you're unsure about some of the terms used in an interview, it can be quite difficult to answer a question. So I would advise you to revise key terms such as clinical governance, quality assurance, risk management, and an audit cycle. And I have some short, simple overview videos that are all free on my YouTube channel that give a helpful overview to any healthcare professional on clinical governance, for example, or risk management or audits in healthcare. So hopefully you'll find them useful as well. You may also be asked questions relating to education of self or others. So think about how you'd answer questions such as how you keep yourself up to date, how do you ensure that your practice is evidence-based, and this is going to be individual to you and your career, and whether you're a student or an early career nurse or more senior role. Give an example where you have educated a member of staff or a patient. What strategies worked and what could have improved? Or how would you support a student staff member who was struggling? How would you promote a positive learning environment in the endoscopy unit for students or new starter nurses? And some of these questions probably align more to a band 6 or 7, but it's helpful to think about some of those questions if you think that they link to the job description and the role that you've applied for. It's also helpful to revise some specialist questions, and all the prep I mentioned earlier might help you answer some of these questions. An example might be, talk me through informed consent procedures and how you would explain potential risks to patients. And as I mentioned earlier, it's important to review consent procedures and potential complications of procedures before your interview, just in case you're asked questions about consent or patient education. There's lots of guidance out there linked to explaining endoscopy procedures and complications to patients. For example, using active listening, breaking down complex information into simple chunks of information to aid understanding where necessary. So do some preparation on this sort of question. Another sort of specialist question might be, what are the potential complications of a particular procedure? So as I mentioned earlier, you need to know what the key terms are, what are the types of procedures that this service carries out, and then you'd be able to look up some of those complications. And it's helpful to review national, local guidelines on procedures, potential complications before your interview. For example, excessive rectal bleeding post-endoscopy, and that requires immediate medical attention. Question might be, how would you manage a patient who is in hypovolemic shock due to excessive rectal bleeding, or how would you manage excessive rectal bleeding post-procedure? So you could use your A to E assessment and talk through that sort of question, the answers to that sort of question, and think about preparing it before your interview. Another question might be, talk me through what you would do if a patient was having a severe reaction to a recently administered sedative, because some patients may require sedation. So have a look at some of the sedation medication that might be given. What are the side effects? And what would you do in this urgent medical emergency, such as stopping any IV sedative? You might have to give an antidote to a sedative. Obviously, you're ringing the emergency buzzer, you're calling for urgent medical treatment, and using a systematic A to E approach would help you. So revising that sort of approach and what you would do is helpful to do before your interview. You're often asked scenario-based questions in interviews. What would you do if X, Y, Z happened, for example? And I've put a few here. You never know what type of scenario questions you're going to get. But if you read around some of the topic areas I gave you at the start and some of these areas, it might be worded slightly different, or you might not get any of these questions, but it's helpful to prepare. So the first type of question that's, very prevalent in these sort of services is the deteriorating patient scenario. So you need to know how to recognise an acutely ill or deteriorating patient, and they can give any range of scenarios. So knowing what the parameters are for blood pressure, for pulse, for temperature, for oxygen saturations, knowing about your escalation policies are all things that will really help you to answer such a question. And also knowing your A to E assessment. And what they're assessing here is that you are a safe practitioner. Another typical question might link to consent. So a patient wants to withdraw their consent in the middle of an endoscopy. What would you do? Now, patients all have the right to withdraw, and if they say that you want you to stop the procedure, then you must stop as long as it's safe to do so, so you don't put the patient at risk at that time. And the endoscopist should assess the situation, discuss options with the patient, for example, and it might be that they just need more painkillers or sedation, and that they want to carry on. It's just more to do with pain and being uncomfortable, but it's going to be individualized to that patient. But you're always taking a person-centered approach and a safe approach, and everything must be recorded in patient's notes. Now, I'm not going to give you the complete answers that I would give here, but think about reassuring patients, think about how you would approach this sort of question. Another typical question is somebody refusing to be consented. So a patient who has a learning disability might be refusing to have an endoscopy, but his mum's insisting he has to have it. What would you do in this situation? And this is very much dependent on whether that person with a learning disability has capacity to consent. The situation requires an empathetic, reassuring approach. You're going to need to know about the mental capacity assessment and are they capable of making that decision. There may be a team approach. Is the mother consenting on behalf of that person because they do not have the capacity to consent and they put themselves at risk by not having an endoscopy? There could be a risk of cancer there, for example, or severe bleeding rectally that's going to harm that person, and they really need to do this investigation. But if the person has capacity, you absolutely cannot force someone to have that endoscopy. So have a look at consent, mental capacity assessment before your interview for this type of question. So if you're going for a more senior position, I've got some really helpful videos looking at leadership interview type questions, clinical governance interview questions. You may have to do a presentation as part of your interview if you're going for a more senior position. So I've got tips on how to prepare a presentation for your nurse interview, and also a question, a video on Band 6, Band 7 senior nurse type questions that might come up. So you might find those videos helpful. They're all free on my YouTube channel. So good luck. I wish you all the best in your interviews, and do let me know how you get on. And I hope you found this video helpful. If you do, don't forget to give it a thumbs up on YouTube.